I'm John Leifer, your host for this video series on how to become an empowered healthcare consumer. I've spent almost the entirety of my adult life immersed in the healthcare industry. As a senior hospital executive, a consultant to a great many health systems, an academician, and an author. Now, I want to share with you the lessons I learned from 35 years in the trenches. Important lessons that I believe will fundamentally transform the way you look at healthcare and the way you purchase healthcare for yourself and for your family. Together, we are going to pull back the veil that enshrouds healthcare and in the process transform it from a blind purchase to one that involves a great deal of transparency. In the process, you're going to acquire considerable knowledge that will truly empower you as a healthcare consumer. But first, I want to ask you to think about the last time you purchased an automobile. If you're like most folks, you carefully researched your decision. You looked at your options, narrowed them down, visited several dealerships, selected one, and then began a process of collaborative negotiation. Why wouldn't you do the same thing for healthcare, which is arguably the most important purchase decision you make? Isn't it worth a commensurate measure of your time? There are many things that I want to convey to you during this series, but for now, there's one very important overriding theme that will permeate all of our videos, and that theme is one of variation. There is tremendous variation in the quality, the cost, and the effectiveness of the care delivered by physicians, hospitals, and ambulatory delivery sites across America. I think that bears repeating. Healthcare is rife with variation. It is not a smoothly operating factory of care that delivers consistently effective and efficient outcomes. It is far more like a McDonald's, where every franchisee is empowered to make sandwiches the way he or she chooses. You as a consumer don't know what you're getting until you unwrap your meal. In the fast food business, such variation leads to a lack of consumer confidence and a diminishment of the brand. In healthcare, such variation can make a life and death difference. Healthcare is a journey, and you're going to need a lifelong guide to help you navigate the terrain ahead. So job number one is to find what a physician friend of mine used to call a good apple. A doctor who's absolutely dedicated to clinical excellence, is empathic to your concerns, and will work with you collaboratively to maximize your health and well-being. There are many other virtues that you may wish to consider when selecting a physician, but we'll save that topic for further discussion in our next video. If this sounds like a lot of work, it is, but it's also a choice. You can choose to remain blissfully unaware and begin to acquire information and make discerning decisions about your doctors and your hospitals and other points of care. Remember, physicians vary greatly. They vary in their training, their acumen, their diagnostic ability, their surgical dexterity, and a host of other virtues that can be very important to your clinical outcome and to your satisfaction. There is no perfect physician, except perhaps my wife. We have a great deal to talk about. During this series, we're going to cover a wide range of topics, from how to pick the perfect physician for you and your family, to how to collaboratively participate with your doctor in making decisions regarding your treatment. There are two things that I ask of you: that you take notes and listen intently. If you do, I can promise you that at the end of this series, you will feel far more empowered to make astute decisions when dealing with the healthcare system, and you will receive far better value for every healthcare dollar that you spend.